Hello and welcome to Office Hours. I'm Dr. Meghan. I'm a board certified physician in internal medicine, lifestyle medicine, and obesity medicine. And I'm also a certified life coach. This is important because I actually talk to patients about their weight all the time. I actually prescribe these medications all the time. I've helped hundreds of patients lose weight, and I'm here to help you too. So if you are confused about your weight, if you have questions about weight medicine, and if you want medically based answers to your weight questions, you are in the right place. So let's get started. Today for office hours, as a caveat, of course, I can't answer personal medical questions. So if you have a question and it does lean a little personal, I'm going to change it slightly to make it more broadly educationally applicable. But I love helping out with your questions. So if you have questions afterwards, you can definitely leave them in the comment section below, or you can leave them on a video, your choice. And let's get started. Also, side note, I can help you directly if you want to work with me one-on-one. I do work with people to help them fix the one big thing that is interfering with their weight loss efforts. I will put all the info down below, and let's get started. So, in theory, is lip swelling after a few hours after Saxenda normal? And the answer is no. So you can definitely, a person can definitely have an allergic reaction to Saxenda. If somebody had, acutely allergic type symptoms, that's someone who should seek emergency medical care, like wheezing, tongue swelling, lip swelling, anything in the airway. That's a person that goes to the emergency room. Any sort of question like, is this an allergy? Is this not an allergy? Those are questions that should definitely go to the prescribing physician. If I had a person who wasn't sure, that's somebody that should definitely not take that medication again until they talk with their physician and go over it in more detail. So I hope that is helpful. Is compounded Tirzepatide okay to take for people who have kidney stones? Great question. I'll get my standard answer out of the way, which is I don't think compounded Tirzepatide is ever a good idea. I've made a lot of videos about that, and I talk about it all the time. The FDA doesn't think it's a good idea. The Obesity Medical Association doesn't think it's a good idea. However, let's just put that part aside and talk just about the idea of Tirzepatide and kidney stones. And in theory, yes, Tirzepatide is something that if somebody had a history of kidney stones, it would not be a contraindication the way that some other medications, other weight medications are for somebody who's had kidney stones. That being said, if a patient did have kidney stones, it's a good time to have a discussion with the prescribing physician about what to look for. But also, that's a good time for the prescribing physician to discuss, other, circumstances that could predispose one to kidney stones if you're already predisposed. So that would be something like acute dehydration, because sometimes what happens on these medications, every once in a while, people have these kind of like food poisoning reactions where they're vomiting a lot, or they have a lot of diarrhea, or they're just losing a lot of fluid one way or the other. And when people get into those situations, sometimes they can be more predisposed to kidney stones. But as a general rule, when I'm prescribing these medications, I do feel that the GLP-1 medications are preferred as opposed to other medications for weight when it comes to people who have a past medical history of kidney stones. So something to keep an eye on, but for me, not usually a hard stop in terms of whether I'm going to prescribe it to somebody or not. Okay, next question. Actually, this is more of just something I wanted to share because I was talking on a video a little while ago about liraglutide, which is now generic, which is great, but from what I have seen, like the prices haven't been that good. However, thank you so much for writing in. Generic liraglutide is actually almost reasonable at Rite Aid or Walgreens with a good RX coupon. $250 to $325 a month for the top dose, or $165 to $225 if you only need to go up to a medium dose. Still pricey, but downright cheap compared to other GLP-1s. Yeah, so that's pretty. I mean, 165 to 250 for a month is a lot better than what I have been seeing. So this is just another good example of sometimes the coupons really help. Doing your research helps, trying different pharmacies helps. So thank you so much for writing in about that. I so appreciate that. And if you are somebody who's on Saxenda or you're thinking about Saxenda, it's now generic. And so this might be helpful information for you. So thank you so much. What happens if you are on the highest Zepbound 15 and been on a stall? Is there nothing else to titrate up to? This is a very good question. The thing about any of these medications is once you get to the highest dose, eventually somebody is going to plateau at their new normal. And so the medications, this is what I tell patients. It's like, it's exciting, exciting, exciting. And then it's boring essentially for the rest of your life while you're taking this, because they're only going to get you to a certain point. And for a lot of people, they're not going to lose all the weight that they're intending to on one medication. Now, if they do, that's terrific. Awesome. However, for some people, given what their goals are, what they and their doctor feel is healthy for them, that might not happen with just one medication. And so, for anybody that thinks that they are stalled or plateaued, yes, you're going to reach a new normal on this medication. Now, whether that is where a person wants it to be or not is a different story. So, if there's a person who has only lost 5% of their body weight on just to dial it back a minute, Zepbound, the average weight loss is about 20% total body weight. So if somebody is not close to that or approximating that, that's a really good time to have a chat with their physician to see, are there other things that are interfering with this? Have I had a lot of interruptions in my dosage? Is there something else that might be interfering with the achievement of the average weight loss? And also there are going to be some people, it's a bell curve. So some people are going to lose more, some people are going to lose less. So if a person is not near that target, a really good time to have a chat with your prescribing physician. Also, for people that the medication is not helping them achieve that final kind of number or range that they want to be in. For some people they just don't get there with one medication, then you need to add something else. So when I'm talking to patients, it's like, okay, we know now, this is where you're going to get with Zepbound. Now, what are we going to do next? Are we going to do more lifestyle changes? Are we going to add another medication? Are we going to look at your medication list, see if we can take something off and see if that makes a difference? So there's a lot of different directions that somebody can go in, and it really, hinges on that discussion with their physician. However, the goal is that you do stall on Zepbound. You just want to be stalling close to where your goal is. So I hope this was helpful. Again, that range is about 20% of the total body weight. That's a good number to have in your head in terms of what is normal on this medication. So thank you so much for that question. That's going to do it for today. Thank you so much for watching. As always, you can leave questions down below. If you want to work with me directly, I'll leave that info below. Thank you so much for your questions. I love helping out with them. You can continue sending them. If I haven't gotten your question yet, I definitely will. It's on the list. Thank you so much for watching, and please be well.